Good morning. How are we doing today? Good. I see some of us, we have our red on. We have our red on, right? Or something red, right? Today is National Heart Health Day. The whole month is dedicated to that, and it's specifically for women, okay? Women seem to be at the bottom of the totem pole when it comes to heart issues, okay? So that's why we have a whole day for awareness of that, to let everybody know, hey, we count too, all right? And we present differently, okay? We don't have the typical heart attack symptoms that could bring upon testing and things like that. So you have to be an advocate for yourself, okay? If those symptoms are nausea, fatigue, extreme fatigue, say something to somebody, okay? That's important, all right? I personally, my mother-in-law had one heart attack and she passed away. And this is going back into the early 90s, but she also had a female cardiologist. So, make that noise, okay? Whatever you do, make that noise. If you don't feel right, make that noise. So, with that, I have two wonderful students here from Wilkes-Barre University. They are pharmaceutical students. I have Hannah, I have Steve. They're going to begin their presentation, and Nicole will be coming in shortly, and she's going to finish up the presentation. After the presentation, the students are going to stick around and take blood pressure. So if you'd like to have your blood pressure taken, just stay put, and they will help you, okay? Are there any questions? All right, then we're going to get started.
Thank you. Good morning, everybody. Wow, such a lively crowd. I love it. Thank you for bracing the cold and coming in. We're so happy to see a room full of smiling faces under those masks, right? All right, so happy Heart Health Day. Today, Stephen and I will be going through some information about how to keep your heart healthy and what you can do. And like Doreen mentioned, Steve and I will take the first half of the information. Second half will be our preceptor, Dr. Nicole Pizzino. She'll be over shortly. She's driving in from Schnecksville, and she'll be here about 10:45-ish. So if you see someone coming in last minute, that's her. Come on in. All right, so we will take blood pressures at the end if anyone is interested. We also will have time for questions at the end. So if any questions come up along the way, save those for the end and we'll be able to answer them for you. Can everyone hear me okay? Thumbs up? Okay, very good. Okay, so what are we going to be discussing today? First, we are going to talk about why heart health is important. Why do we have a whole day to celebrate this? We'll be talking about blood pressure, what your measurement means and how you can monitor it yourself at home. We'll be going through cholesterol, different types of cholesterol. Some is good for us, some not so good for us. And then we'll talk about different ways to keep our heart healthy. So we'll be doing this by eating healthy foods with nutrition, getting in some exercise with our physical activity, and then we have some tips and tricks for taking our medicines. All right, so first up, why is heart health important? Why are we going to talk about this for an hour today, and why should you listen to us? So, as you may know, heart disease is the leading cause of death in the United States. It's actually the leading cause of death in the entire world, and so that in itself is very important. Now, when I was looking up statistics for this presentation today, I found one that I thought was really mind-blowing and interesting, and that is that in the United States, every minute, so every 60 seconds, about 2 people will pass away due to a heart disease-related death. 2 people, every minute. And so I said this presentation is an hour today, so that's about 60 minutes. So just during the course of our presentation today, over 100 people will lose their lives due to heart disease. So very important that we keep our hearts as healthy as possible and try to reduce our risk. All right, so I mentioned heart disease, leading cause of death in the United States. Now looking at this a little bit further, per year, so every single year, heart disease will claim more lives than all types of cancer combined. All of them combined. Now this is a lot of doom and gloom, but there is good news. Everyone has the ability to improve their heart health by eating healthy foods and getting in that exercise. So don't worry, we can reduce our risk. All right, so first thing we want to talk about today is blood pressure and go a little bit into that. So what is blood pressure and what does it really measure? Well, blood pressure is a measurement of the force of our blood pushing against our blood vessels. So if we have high blood pressure, this means that the pressure in those vessels is too high. I'm going to put this clicker down for a second so I can show you something. So who in here has used a garden hose? Raise your hands. Right? Probably just about everyone. Now, when you turn the garden hose on and the water starts flowing out gently, that's what I like to think our blood vessels look like when we have normal blood pressure. The water's flowing gently, everything's good. Now, who has used a garden hose and put their thumb over the top of the hose, right where the water sprays out everywhere? Okay, maybe you're trying to water a plant far away or you're spraying somebody. That's what I think about when we have high blood pressure. The pressure in that hose is so high that the water is trying to escape to get out. That's kind of what I think about in our blood vessels when the pressure is so high. It's kind of a similar idea. Now that's very simplifying of the blood pressure. It is definitely more complicated than that. Our bodies are amazing. There are a lot of different organ systems, our kidneys, our heart, our vessels, all take into account for blood pressure, but I really like that visual because everyone has used a garden hose and knows what I mean. All right, so why do we care about high blood pressure, right? Because most people who have high blood pressure probably feel exactly the same as they do if they have normal blood pressure, not usually a lot of symptoms. So why should we care about this? Well, think about that hose with your thumb over the top. All that pressure in your body is not good for the body, right? So having high blood pressure increases our risk for heart attacks and strokes and all the things we want to avoid. So that's why it's important to keep our blood pressure down in normal range. All right, so let's talk about some risk factors for high blood pressure. Sorry, the font is a little small up top. Not sure what happened there, but I'll go through it. So some risk factors for developing high blood pressure. We have some things that unfortunately we cannot change. But then we also have some things that we can change, and we're going to talk about those today. So what can we not change? Well, unfortunately, we can't change our age. There's no fountain of youth. As much as Cher likes to sing about it, we can't turn back time. So having an increased age does put you at a higher risk for having high blood pressure. Also being male, and having family history of high blood pressure. So if it runs in the family, mom, dad, brother, sister had it, you're at a higher risk. But what can we change? Well, we can change what we eat, right? If you have an unhealthy diet, predominantly with a lot of foods that are high in salt or high in fat or high in sugar, that puts you at an increased risk. So that's something we could change. If you're not getting enough physical activity, that's something we could change. Being overweight goes with those two first ones. Having high cholesterol, as well as cigarette smoking, which I feel like not a lot of people know about that, but any tobacco product use does increase your risk for high blood pressure as well. All right, so what do our numbers mean? I take it everybody has had their blood pressure taken at some point, and say the nurse turns to you and goes, your blood pressure today is 120/80. What does that mean? Well, let's look at the numbers. So for example, your blood pressure today is 120/80. We're going to look at the top number first. That's what we call in our medical terms as systolic blood pressure. This is usually the larger number of the two, and it measures the pressure when your heart is actively beating. Bottom number here is 80. That's what we call our diastolic blood pressure, usually the smaller number of the two. And this is measuring the pressure when the heart is resting. So it makes sense that the pressure is a little bit higher when the heart is beating and a little bit lower when it's resting. Okay, so what do we want those blood pressure numbers to be? Well, these are some general goals that we'll go through. So if you have a diagnosis of high blood pressure, so if a doctor has ever told you you have high blood pressure, we want your usual goal, blood pressure, to be less than 130/80. If you've never had high blood pressure, therefore you have normal blood pressure, we want your goal to be less than 120/80. Now these are general. These are general goals based on our current guidelines that we have by the American Heart Association, but everybody is different. Each person is unique. So these pressure goals might not be right for you. These are general. So if you're not sure what your blood pressure goal is or what it should be, you can ask your provider at your upcoming appointment. All right, so how can we measure our blood pressure at home? Does anyone have a home blood pressure monitor? Yeah, great, awesome. Okay, so we'll be going through some tips and tricks on how to use that. So the home blood pressure monitors are really great tools, help us keep track of our blood pressure at home over, weeks at a time instead of once every 6 months when you see the doctor. We do typically like the monitors that go around the arm. They are more accurate than the ones that go around the wrist or the ankle. So try to use the arm monitor if you can. I will be going through how to use the arm monitor. If you only have a wrist monitor or that's all you have access to, that's okay. They are a little bit different in how you use it compared to the arm monitor. So if you have a wrist blood pressure cuff, just ask your pharmacist or your healthcare provider how to use it. It is slightly different. Now, if you don't have a blood pressure monitor and you would like to get one, some pharmacies do carry them in stock. Otherwise, they are available online. And this Omron brand is a really good brand. Okay, so some tips and tricks. When you are going to take your blood pressure, we like to avoid smoking, well, always, but smoking, exercise, or having caffeine within 30 minutes of taking the reading. That's because all three of these things can raise our blood pressure, and we want to get the most accurate reading. So if you just had an extra large cup of regular coffee, we probably want to wait about a half an hour before we take the reading. All right, when you're ready to go, we're going to have you sitting, resting, and relaxing in a chair for about 5 minutes. Again, having this relaxation time will help the blood pressure come down. For about 5 minutes before your reading, we're going to have your arms resting either on the armrest or on the table. While you're sitting in that chair, we're going to have your feet flat on the floor, not crossed, not ankles crossed, flat on the floor. Actually, having your legs crossed or your ankles crossed can change your blood pressure reading by up to 10 points. And that's in either direction. That could go up or down. So we try to keep our feet flat on the floor when we get the reading done. We're also going to have our back straight in the chair. We're thinking good posture. When it's time to actually take the reading, we're going to place the cuff on bare skin. So try to do it on bare skin, not over a shirt or heavy sweater, because it can alter the reading a little bit. We're going to have the bottom of the cuff just below the elbow line. All right, so here we have a diagram of someone showing us beautiful positioning for the blood pressure. Just a reminder, we're going to avoid smoking, exercise, or caffeine within 30 minutes of the reading. You can see he's sitting in his chair. He's going to sit there for about 5 minutes before we take the reading. His arms are resting. He has his palms facing up. I'm not really sure what he's doing with his hands. They're kind of at an awkward angle. You don't have to do that. His feet are flat on the floor, and he has the cuff right above his elbow. All right, so when you take your reading at home, remember that one reading is just that. It's just one reading, one moment in time. So I encourage you to keep a log book to track your blood pressures over time. So whether that's a notebook or a napkin, keeping track of your blood pressure at home, we can see a trend, and then you can bring that into your office when you see the doctor as well. So when you are tracking your blood pressure in the log, I want you to include 3 things. I want you to include what the reading was. So say, for example, it's 120/80. I want you to put the date. So today is February 3rd. If you can believe that January flew by already, we're in February. And then also the time of day is important as well. So You can put down what time of day it is. You can check your blood pressure at different times of day. Maybe it's higher in the afternoon, lower in the morning. Keeping a log will help us figure that out. And then once you create this beautiful logbook at home, we want you to share it. Don't keep it to yourself. Bring it into your next doctor's office visit, or if you have a nurse visit, so that they can see your blood pressure over time as well. Does anyone keep a logbook of their blood pressure readings? A few? Great. All right, so that's some basic information about blood pressure. I am going to pass the torch over to Stephen to talk about cholesterol.
Thank you, Hannah, for teaching us about blood pressure. So I'm going to go into cholesterol right now. So, what is cholesterol? Does anyone think they have an idea of what cholesterol could be? You keep that in your mind. Cholesterol is a waxy, fatty substance that can build up in our arteries. It's very sticky, so it can easily adhere to your artery walls as well, or your vein walls. So it's made in the liver, and it can also come from foods we eat as well. So why do we care about the high cholesterol? Well, bringing back the garden hose example, as Hannah mentioned earlier, when it's unhindered, it can just flow freely. But when we have the cholesterol buildup in the artery, like in the garden hose, we constrict the area that the water can flow through, and that increases the pressure. Anywhere that does not have good blood flow, or blood flow is kind of stagnant, we can see problems with that artery there. And it also increases risk for clots as well. So, and that's why we can see as plaque can block blood flow, it increases your risk for a stroke, heart attack, strokes and heart attacks. So, true or false? What we eat and how much we exercise are the only risk factors for our cholesterol levels. So this is a kind of a tricky question. So let's see if anyone, with a show of hands, who thinks this statement is true? All right. And anyone who thinks it's false? All right. All right, you're right. We couldn't trick you. All right. So while nutrition and exercise are important factors to our cholesterol levels, they're not the only factors. So we'll go over some of those factors now. So similar to what you saw for the risk factors for high blood pressure, we also have risk factors for high cholesterol, but they're very similar. So there are some things we can change, some things we can't. What we can't change, increasing age, being male, and then family history of high cholesterol. Some things we can change is like the healthy diet, like Hannah mentioned, foods that are high in unhealthy fats, high sugars, things like that. And then also too little activity. Later in this presentation, we'll get into more exercise recommendations, but for right now, just too little exercise is also a risk factor as well. Also being overweight, smoking cigarettes, and as well as having high blood pressure is also a risk factor for high cholesterol. So, what are the different types of cholesterol? Well, there's two main types. There is the HDL, which is the good cholesterol, and the LDL, the bad cholesterol. So you can think of cops and robbers. The HDL is the cops, and the LDL are the robbers. The HDL goes around and makes sure the LDL is not causing trouble. It's not congregating anywhere. It's making sure that your arteries are clear. So HDL is the good type of cholesterol. It helps remove cholesterol from your bloodstream, so it doesn't adhere to the artery walls. But LDL is the bad type of cholesterol. That's the one that can really adhere to the walls of your arteries and cause the problems where you have the clots with those. So, cholesterol level goals. Normally, every 6 to 12 months, they are checked by your doctor through a blood test. And then lab work is normally fasting. Obviously, for the HDL and LDL have different values. For HDL, for men, we want it higher than 50, and for men, we want it higher than 40. For women, we want it higher than 50. And then for LDL, we want it less than 100. Obviously, these are very general based on the guidelines, so you can always talk to your doctor if you have concerns and see what they want your LDL or HDL to be above or below. Because we have seen other recommendations from providers that want their LDL to be lower than the 100. So what happens when the plaque forms? As you can see, we have a normal artery. It's unhindered. You can easily pass blood through there. And then we have the narrowing artery, where we have that yellow cholesterol kind of blocking the artery. So that increases the risk of heart attack, stroke, chest pain, and poor circulation. So what can we do to keep our hearts healthy? We can eat healthy foods, we can have fun with exercise, and take medicine as prescribed. So what do you guys think is the best thing that we can do to help manage our cholesterol levels? Diet. Yeah, diet's one. Exercise is actually the most important one. For HDL, yes. All right. No. All right. Now we have Nicole to give the rest of the presentation.
Thank you. And they didn't plan that. They didn't plan to say that with her. My name is Nicole. I'm a pharmacist. Thank you for having my students join us and for me to join you here today. We are going to transition over into a little bit about nutrition, because nutrition does also affect your blood pressure. So if you have high blood pressure, the amount that it can affect your blood pressure is a little bit different than if you were to not already be diagnosed with high blood pressure. So specifically, this is going to be following a diet high in fruits, vegetables, whole grains, low-fat dairy products. And you can see if you don't have high blood pressure, it can help reduce your blood pressure about 3 points. Or if you do have high blood pressure on the right, it can help to reduce it up to 11 points, which is really helpful when you do have high blood pressure, because especially as we get older, that top number tends to creep up. I think you may have heard Hannah talk about how we wish we could turn back time, but we can't yet. And even when we can't, blood pressure raising as we age is one of those things, but we can help our diet and what we're putting into our mouth. So here are some examples of some nice heart-healthy foods. I know you all work with a dietitian, and there's one here that you can work with. I encourage you to meet with them. I think they're a fabulous resource that you can have with how do you pick foods that are best for your heart. So I have 2 babies at home, and while I was pregnant, for some reason, I could not put a vegetable in my mouth. I just would not eat them. The dietitian I worked with gave me some really creative ways to help me not hate them, to be able to tolerate them and eat something green. So that is one of the resources I do encourage people to utilize, is if there's certain colors of the rainbow that you're not enjoying, go ahead and see if there's a different trick or tip for eating it. My kid, I've now learned if I can grind up some cauliflower and add it to his French toast, and he has no idea that there's cauliflower in it. I know it's there when I eat it, but he has no idea. He just doesn't even see anything different. So there are tips and tricks, and those are a lot of what the dietitian will share. So again, here are some different options from the rainbow that you can think about. A dietitian's dream, and I work closely with one, would be every single plate you have every color of the rainbow. I try and go with as many colors as I can do, but not all of mine are perfect, because we also realize we're human, and there are some times that while cookies don't necessarily fall in any of these rainbow categories, they are also something that you can enjoy at moderation as well. So when you look at your food labels, you'll see, I find now when I go to the grocery store, I just remember when I was a child shopping with my parents, there was not very many options to pick from, and how they made food back in the day was very different than how we make it now. So what I like, though, is there are sometimes these little tricks and tips that are on those labels for you to help. So when you look at Cheerios, or you look at, okay, there's 15,000 maybe options of Cheerios now. If you're wondering which one is the best one, if you look at your ingredient list, the first word you want to see on there is whole grains. And that's what this is right here. So reducing heart disease, and that's because it's got whole grains in it. So whole grains is one of those heart healthy options for you. Continuing on, oats. I know a lot of people like their oats, and by golly, there is about 16,000 ways of making them nowadays. You could do overnight oats. You can add all these fancy things to them. They don't have to be boring like I used to have them when I was growing up. They're actually really fun options for them. And you can see help reduce cholesterol. That's going to have to do with the fiber in there. So having fiber helps that feeling of fullness, but also helps to move things along right through you to help get rid of any of that cholesterol so it doesn't get like stuck in you, we'll say. Nutrition labels, I will say one of my favorite things that have happened as we continued moving along is the food labels have become way less complex in reading. I will still say that there are some complexities to them, but they make things a lot bigger that you need to know now. So calories are the biggest part right there, but then serving size. So it says 230 calories, but let's pretend, I don't know what this is, but let's pretend it's ice cream. I'm not just gonna put like 1 scoop of ice cream in there. I might eat that entire pint. And if you look at the label, it says 230, but then I have to remember to multiply that by 4 because the serving size was intended for 4, not just me. So keep that in mind when you're looking at your labels, your serving size, and then also the calories. One thing that I recently learned from the dietitian I work with is you see these percentages over here. I didn't really know what they meant, but the most important thing about them is the good things you want high, the not so good things you want low. So, and what's good and what's not so good is very different depending on what your individual goals are. So if you're trying to lower your sodium intake or your salt, in other words, you would want to look at this sodium content here, and you would want this percentage to be less than that 20%. So you want it to be closer to that 5%. Anything higher than 20 means it's a high percent for that food. So I'm going to go ahead and gamble that this is not my ice cream because there's a lot of sodium in it. I'm going to go ahead. Maybe this is a soup or something. Is it a soup? Oh, it's frozen lasagna. Should have looked right up at the top of the slide. I just got so excited about ice cream. So, and it's because of the frozen, they have to preserve it in some capacity, and so they do use sodium for that. And then your nutrients are right here. So I hone into 3 different parts when I'm looking at it. I look at the fat, I look at the carbs, and I look at the protein. But then again, remember, if you have different disease states, you're going to be looking at different things. So what I mean by that, someone with diabetes might focus on carbs. Someone with blood pressure might look at sodium. Someone who's working on their cholesterol might take a look at that fat piece right there. So each person's going to have different goals, which is why, again, I really encourage you to work with your provider and or a dietitian to see what your goals are. So again, your serving size, take a look at that. Those can be sneaky. They're a little bit more bolded now than they used to be, so it's a little bit harder to miss. But just keep in mind, how much is that serving size? And then one thing we talk about when we do a lot of our diabetes education is we tend to underestimate how much we eat and overestimate how much we move. So what I mean by that is I felt like I walked a mile to get into this building today because I had to park in I probably over at Main Street at Nazareth is where I'm parked right now. And I would say, okay, well, since I walked that far, now I get an entire pie of pizza. That's not the case. So we have to keep in mind that when we look at food, when we really want to know what our serving size is, we actually encourage you to measure it out. Calories, we talked about that. So you're going to look at your calories and make sure it's aligning with the serving size. We talked about your nutrients and then taking a look at these on this side. So what would be really nice with making sure this fiber, you're going to want that closer to that 20% or more. That's going to help with that feeling of fullness. All right, so salt. That affects your blood pressure. So whenever you have salt, water wants to go follow. And when you have water and salt in you, it can raise your blood pressure a little wee bit. So someone without high blood pressure, looking at salt, you can reduce your blood pressure by 2 to 3 points. And then if you do have high blood pressure, about 5 to 6 points. So salt does play an impact on how you can affect your blood pressure. Again, that is right here on our label. Really point that out for those of you that are looking at your salt. And so if you have high blood pressure, we do want to keep that in mind and take a look at that. Kidney beans. So if you do enjoy your canned foods, fabulous. I think they're a great option. And I think they're a less expensive alternative. I see a lot of, if any of you are on social media, you've probably seen like what $100 bought me in 2020 versus what $100 buys me now. So canned foods are a great way to make sure we're trying to minimize costs when you're purchasing your foods. Now, they'll have signs like this on them, no salt added, but I want to show you this other part, no salt added. There's still going to be a little bit in there, but you'll notice that number here is 1%. So that's less than 5. That means it's low or none, and that's good. Another trick, if you do have salt in your frozen foods or in your, not in your frozen foods, in your canned foods, there are some tips and tricks that you can do with that food to try and reduce that salt content. So for example, if you look at these cut beans, undrained is on this side, drained is on this side. So just by putting it in a strainer and rinsing it off with some water, you actually get rid of some of that salt content. If you were to purchase frozen food, frozen fruit and vegetables, what's nice about that is it's flash frozen at peak ripeness. So you're keeping a lot of those nutrients without adding the salt. So I would say your canned foods are going to be your least expensive. Frozen will be in the middle there. And then your fresh fruit and vegetables will be the most expensive on that list there. And there's just some things that you can do to help reduce that salt or reduce the preservatives that they use in the cans. Ranch dressing. So oftentimes when we're eating our rainbow, we end up putting a lot of dressings on our salad. That's the only way you can get me to eat a salad. So you can, again, one thing I'd keep in mind is your serving size is only 2 tablespoons, and then how much sodium is actually in the ranch dressing here. Another frozen food option, because again, these are really nice, quick, and easy meals to do. When you're looking at this label, when you're thinking of your frozen foods, again, it's going to be the sodium, that's that sneaky ingredient in your frozen foods that are prepared already. So not your fresh fruit and vegetables. When those are frozen, those don't get salt added, but these types of foods that are already prepared for like a meal, you will tend to see some salt in those. All right, so then we think about, okay, so salt can raise blood pressure. Potassium actually kind of fights salt and can help your blood pressure. So you can actually see here, having the correct amount of potassium a day can help your blood pressure also. And you can see those numbers listed right there. And the best way to get potassium, I'm a pharmacist, I don't recommend pills if you don't need them or supplements or vitamins. Food is going to be the best way for you to get these things that we're talking about today. So can any of you think of something that has potassium in it? You got it. I always think of that from Honey, I Shrunk My Kid, when he had the banana that one day and we were talking about potassium. Did you ever see that, Honey, I Shrunk the Kid? That was definitely from when I was a kid, so I feel like a lot of you had to have seen it. It's like 35 years ago I saw that movie. And so, yeah, they shrunk the kid, and the kid was having issues, and they're like, we need something with high potassium, and the child ate banana. Anyone know any other foods with it in it? Yes, very good, very good. So you can get it with your diet. So keep in mind what foods you're eating to help your blood pressure as well, and some nice bananas, avocados, and things like that can help as well. And again, you can see some of the foods like high in potassium. The next one is alcoholic beverages. So recently, again, I do go on social media. On social media, a recent trend is like, yes, I only have 1 glass of wine, and then that entire bottle of wine fits in 1 glass. Or they say I have, yes, 1 drink a day, and then that drink is actually like 5 or 6 serving sizes of one. So alcohol is important to keep in mind because We want to limit it to the recommendations for males versus females. So females, we get 1 drink a day, males 2, and I'll talk about what that means. That's not an entire bottle of wine. What it is, though, is over here, you'll have about 12 ounces of regular beer. You can have 8 to 9 ounces of malt liquor, 5 ounces of wine, which is actually a pretty small amount, and then 1.5 ounces for your more of like stronger liquors, distilled spirits. Any questions on nutrition? I know this was an overview. I like to say that we give sneak peeks here. Any personalized questions, I do encourage you to work with your dietitian here, though, because I do think they're a fabulous resource. I work with one, too, at our site. Any questions on nutrition? I always keep my answers real. So if someone came to us yesterday, he had an appointment with us, and he goes, Nicole, I'm willing to talk to you about my diabetes, but don't take away my Pepsi. Because the last person I worked with tried to take away my Pepsi, but you cannot do that or I'm going to leave. And so if you have something like that you enjoy and you think someone's going to take it away from you, we won't. Just tell them what you enjoy, and we'll work around that with you. All right, physical activity. How many of you do physical activity at least like once a week? Okay, yay. So my grandma actually lives here too. I don't know. I can't believe she didn't come today. I'm going to have to go knock on her door and be like, where were you? But I know that she was talking about ballroom dancing, and you have a lot of really nice opportunities to get active here. Yes. Yeah. Good question. So the fake sugars that people talk about that keep things sweet so that we can enjoy them, like the artificial sweeteners you're thinking? Okay. So the jury is still out on them in terms of evidence-based, but I was recently on a call where they talked about when you have something sweet and it goes into your mouth, what happens is your body starts preparing for it in the rest of your body. So you taste sweet, and then they have what we call, the medical term is a receptor. Basically, it catches the sugar and processes it for you. So if you have fake sugar, those receptors get ready to catch the sugar, but nothing comes. So some people will say that it might make you crave more sugar and not actually be super helpful. So some people will say, again, depending on your individual goals, if you want Pepsi, have 1 regular glass versus the diet. But then there are other people that have like 6 cans of Pepsi a day, so then we would want them to more so have the no. Honey, so again, if you have diabetes, honey is going to go like this to your blood sugar. But if you enjoy a scoop of honey or 2 scoops of honey in your tea throughout the day, we say go ahead and enjoy that. What's nice about honey is it's natural. It's from the world. So that's what we like about that. Yeah, good questions. All right, so physical activity. I enjoy running. So sometimes when people come to me, they're like, okay, but I'm not running and you're going to make me run. No, I'm not. We're actually doing interviews right now for a new position that we have at my pharmacy. And the person goes, I know you like to run, so my goal is to finish a 5K. I was like, that's great. You don't have to run. If you wanted to dance through that 5K, if you wanted to swimming is a fantastic option. Do you remember when you were younger, you would just turn on music and just dance in your living room and dance in the mirror, get on the ground and play with some grandkids or play baseball? These are all great forms of physical activity. So physical activity is whatever you personally enjoy that you're going to get excited about. If going for a walk makes you cringe, that's not the physical activity that you should be doing then. I mean, of course, you're going to have to get somewhere somehow, but maybe it's lifting some weights. Maybe it's coming and doing yoga or meditating, or there's so many different options. Now, We want to eventually work to a goal of 150 minutes per week, but we never jump right into 150 minutes a week. We generally start slow, and I feel like here you might have a great resource sitting in the front room, Doreen, to be able to help you find things that you enjoy. And I can't imagine that she would say, okay, starting tomorrow, we're going to do 150 minutes of activity. I feel like she would start slow with you as well. What that does is it helps to keep your heart healthy. So I want you guys to think about this. True or false? Does your heart ever take a rest? This is a tricky question. I have a 50-50 split, it sounds like. Good. So it does. It actually rests in between beats. So what happens when you work with physical activity, it makes your heart pump nicely to get stuff around you, but then your heart is a muscle. So by you doing physical activity, that heart muscle is building strength. And that can help lower your heart rate just a little wee bit. And that what it's going to do is give your body more time for rest. Or your heart more time for rest. So let's say on average, someone's heart beats 80 beats per minute. Now let's say you start exercising, building some of that fitness. Maybe your heart now beats only 78 beats per minute. Now you have that extra 2 beats that your heart gets to rest per minute. So in between those heartbeats, your heart does get to rest. So it's a muscle, just like everything else that we're working when we're working out. And so we do want to build that muscle so it does have some ample time to rest. Benefits. I worked at a clinic in the VA, and at the VA clinic, the provider would he would sit down with a patient and be like, I know something. It is 100% free. You get to lower your blood pressure, help manage your weight. And the person would sit there and be like, oh, what is it? And he'd be like, exercise. And they'd be like, oh, stop it. And so mad that was the response. But truly, there's so many benefits to exercise. And I know I stand here, and it's easy for me to say, it can be difficult to find that motivation, to find that energy to do so. But one thing that they've found is maybe instead for you, it's not working out more. The other way to frame it is sitting less. So there's now studies coming out that say even if you just break up bouts of sitting, whether it be by using some like canned goods that we talked about before to do some arm exercises, or it be just getting up and walking around if you've been sitting for too long, that's actually just as beneficial on your heart as anything. So I encourage not sitting also. So if exercise and doing more exercise is daunting, let's shift it to just say sitting less. And I can send Doreen I have really cool trackers for sitting less that she can give you if you are interested in that. Here are some examples that I know I talked about. I actually have a nice list of 152 things that you could do to move around on my when I do my diabetes classes. And again, if you're interested and you're stumped, I'll go ahead and I'll also send you that. So I've got 2 things I'm going to send you to have as resources to use. I do a lot of education classes where I'm at, and what's really funny is having a buddy to do it with just helps with that accountability piece. I have 2 classes. One of them was at 10. One of them was at like 1 o'clock in the afternoon. And sister-in-laws were in each of the classes. In the morning class, the one sister, we'll call her Sister A, she would come in and be like, ugh, I did not want to walk today, but Sister B made me. Sister B would come in at 1 and be like, ugh, I did not want to walk today, but Sister A was relying on me. And I never told either of them until the very end of our year-long program together that each other was saying that in the class. They had no idea that each other didn't want to do it, but they were doing it because they thought the other person was counting on them. So get yourself a buddy, and that might be able to help you as well. So tips and tricks, before doing any type of movement or activity, get clearance from a healthcare provider. We don't want you jumping into doing something. Someone who's licensed in this area, I would never stand here and say, yes, every one of you can start doing this today. I would say get clearance first and then start working towards it. I feel like we probably grew up in the time frame where it was no pain, no gain, right? Not anymore. Our new saying is no pain is gain. We don't want pain. Now, pain is not good. We want to stop if there's pain. I want to caveat that with, if you've never moved and you haven't walked for a long time and you start walking, it might cause a little bit of soreness. Soreness does not mean you have to stop doing it. It would just mean maybe take a day or two off and then start again. But new saying for everyone, no pain is gain. If you hear anyone say no pain, no gain, you would nix that right away and say that's not true anymore. I will follow the no pain is gain slogan. All right, any questions on physical activity before we get into our last section, which is, of course, pharmacy-related, taking medication? Yes.
That rest is as important in exercise as the actual exercise itself.
Beautifully said. Yes, you should not work out every single day. You definitely want rest days. And so what we try and encourage by the guidelines, it would be no more than 2 days off. So if you did 2 days, you would go ahead and do something again. We would want to avoid like the unless you're actually injured, then of course you would want to make sure you do that. But those days that you wake up and you're like, you know what? I'm sick, I'm not feeling good, I'm sore. Your body, you know your body best, and that's what you want to listen to. So resting when you need it is also a very good form of physical activity. Very nice. All right, taking medication. So when we talk to people about taking medication, there's obviously different times you can take a medication. You can take it morning, you can take it noon, you can take it night. Some work better at different times of the day. We did not have the capacity to talk about every single med, when you should be taking it, and plus it varies so much depending on all the other medications you're taking. So one thing I do share with Doreen is if there are people that are interested in us looking at their medication list, we're happy to set something like that up, maybe a time for us to come in and have a couple back-to-back appointments where we actually look at your individual. I'm not going to give any individual advice right now, but if you have a general question, I'm happy to answer any of those. So the most important thing when you have a medication is making sure it's the right one for you, so it's indicated, making sure it's going to work in your body, making sure you're not having any bad side effects, and then once we look at those 3 things, we're going to go ahead and make sure we're taking it. Because a medication is only as good as if you put it in your mouth or wherever it belongs. So keep that in mind. And then, what can you do? So your medications generally have refills. What I always encourage you to do when you get your prescription, or some of you probably get delivery from a local pharmacy that come here, take a look at those refills. And if there's none left or you're starting to run low, make sure you have a provider appointment coming up so you don't run out and go without it. We recently had someone come to our pharmacy. They had ran out of prescription medication, and we took their blood pressure, and their blood pressure was creeping up quite a bit, actually, because they had been without their medicine for a couple days. So if you want to know if your medications are working for you, you can, of course, reach out to me. One of my favorite things to do in terms of blood pressure is take your blood pressure. If you're like, does my blood pressure medicine work? Take your blood pressure, and then go ahead and take your medication, and then like an hour or 2 later, go ahead and check your blood pressure. You'll see it had dropped a little bit. And then you know your medication's working. Same with diabetes. Right before you're about to take your sugar, go ahead and take your medication, see how it affects your blood sugar. Understand the directions on there. I think directions can sometimes be confusing. If it just says take 1 daily on your bottle, find out where you need to put it. Find out what time of day is best to take it. There's some thoughts. Remember how I told you your heart does have time to rest, and that's when it beats a little bit slower. So when you're sleeping, you do tend to have a little bit of a drop, and in blood pressure too. And that's thought to be heart protective. So actually taking blood pressure medication, some of them, not all of them, at night can help reduce someone's risk of a heart attack and heart things happening, which is really neat. But I tend to fall asleep pretty early, and I'm not very good at remembering my medicines if I was to take it at night, for me personally. So for me, I would do better at taking it in the morning because that's when I'm going to remember. So there's 2 caveats. Best time to take the medicine, part 1. Part 2, when will you actually take it? So we have to put those 2 together and find a schedule that works for you. Pharmacists are a great resource for that. Ask questions. My favorite, and we have this a lot in clinic, people will come with a written list of questions and ask them. I encourage you for every provider office visit you have with your doctor, whenever you go to the pharmacist, bring a list of your questions. That way, if you get off tangent, you have another thing come up, you don't forget the questions that you had. And ask them. Ask them how it's going to work in your body, what it's going to do, what side effects you might have, what time of day you should take it. These are all things that are really good to be asking your healthcare provider. So tips and tricks. If you find yourself running out of medications and it's getting kind of annoying, you could potentially get a 90-day supply. A lot of insurance plans are now covering that. And so if you are someone that doesn't like to go every 30 days, A, there's usually pharmacies that'll deliver. B, you could see if your insurance will cover 90-day supplies for you. Yes, oftentimes it's less number of copays too. Forgetting to take your medicine. So tips and tricks with that. I have a couple people I work with that really like aesthetically pleasing things in their home. And so they'll have like a nice, pretty reminder like frame on their wall or something like that. I actually, if you're someone that tends to forget, I encourage you to make it obnoxious actually. So like hot pink sticky note on the wall that says take your medicine, or something that you're gonna be like annoyed when you see it sitting there that you're gonna remember until it becomes habit. Other things people do are phone alarms, if you know how to do that. Some pharmacies actually have apps that'll alert you, hey, take your medicine. There's a couple different tips and tricks with that. Again, if you need more ideas, I'm always full of ideas and we can talk about that. Out of sight, out of mind. So oftentimes I'll hear people say that they store it in their bathroom, which if I will say anything as a blanket statement, we actually encourage no bathrooms because the steam, the different temperature changes could compromise the integrity of those pills. So we actually encourage you to keep it somewhere in a nice, cool, dry area. People put it next to their coffee a lot. So put it somewhere where you're going to see it and remember it. Now, if you have kids around, that's where it does get tricky, or grandkids that come by, because you want to make sure it's out of their reach, that pets, kids can't get into it. Doses are not convenient. So I mentioned the most important thing is taking it at a time that you're going to remember it. But maybe if you take it twice a day, morning and night, you compare it with brushing your teeth, because we brush our teeth twice a day. And if you don't, I'm going to do an intervention with you. Please brush your teeth twice a day. And I'm sure your dentist will be happy with me giving that advice as well. Another thing, maybe you have coffee every morning. Maybe you have dinner at a certain time. So try and pair it with something you already do. All right, we talked about a lot of stuff. I always end with 3 things. I always end with a takeaway, replication, and call to action. So my takeaway is there's so many things you can reduce your risk of heart disease and heart things and improve your heart health. We talked about 6 today. 6 is a lot. Pick one thing that you really liked. Maybe it's looking at a label, and I have that on the call to action, and just seeing what's in there so you're aware. Not making any changes, but maybe just at least looking at your food label now. Next one is follow the blood pressure strategies that I think Hannah may have talked about with you all. How to take it to make sure you're getting the most accurate reading. I was recently at my provider, and they took it with my jacket on. And I think Hannah probably went over this, but doing it over any clothing can affect it up to 50 points. And that's right from the American Heart Association. So making sure you're getting an accurate blood pressure reading is so important. So you want those beautiful 90-degree angles that she's talking about, bare skin, and making sure you're getting the most accurate reading. So when you go to your provider, you can bring a list of those readings that they can see. Yes. I know. I know. White coat syndrome is real. Yeah. Yep. So they are, so validatebp.org is a great, I'll repeat it. Sorry about that. Yes, I'll repeat that question in one moment. So validatebp.org has a nice list of blood pressure measuring devices. Omron is an example that's generally going to be on that list of blood pressure at home devices that are accurate. So what I encourage people that are hesitant to know, they're like, I am never high. It's just because of you. Take it a couple times, like a week before going to the doctor, and give them the numbers that you had at home to show them. Because I always say it's never one reading unless it's a super high reading and you're having symptoms. But if you're just one time at like 130/80, and then, but usually you're at like the 120s or whatever it might be, bringing that list of readings you have is going to be way more meaningful than that one time they take it at the office, unless, again, you're having symptoms. She asked about when she goes to her doctor, her legs are dangling, her arm isn't supported, and I know it's the same when I go to my provider. One time they were like, your blood pressure is 90/40, are you okay? And I'm like, yeah, my legs are just dangling, my arm is just chilling, like, if we took it another way, I'm sure I'd be fine, and I feel great. So I think it's just it's a screening mechanism, and generally when you go to your doctors, you probably notice they don't diagnose you after just one reading. It's usually because you were high a couple times. So it's a collection of them. Yes.
Does it mean anything if your blood pressure is consistently a lower number, in the low 60s?
No, there's something, the medical term is like isolated systolic hypertension. Big fancy word for only your top number is high, but your bottom number is right or low. So if you have a high top reading and a lower bottom reading, that does tend to happen with age. If you have a normal top reading and a low bottom reading, that's also fine. The only time it would become a concern is if you were getting dizzy, or like when you stood up, if you felt faint, or if you just felt weird, then maybe they would do something. But if you have no symptoms, they would just say, okay. Yeah, good question. Yes.
Nicole, they've always said 120/80 is the gold standard. Recently, I read that people our age are now allowed to be, quote, normal at 140, 145.
Okay, so this is really, I'm glad my grandma's not here. I'm not telling you who it is because I'm throwing her under the bus here. My grandma, she goes to me the one day, she goes, Nicole, my blood pressure goal is 100 plus my age. I was like, Grandma, you are like 85. Your blood pressure goal is not 185. So I'm glad you didn't say that was your goal. But it really depends. So your goal, they're all individualized. So if you have no other disease states, no other conditions, and you only have high blood pressure, maybe your goal would be different than somebody else's. And there's age goals. There's, if you have diabetes, different goals. And it's interesting. When I first went to pharmacy school, it was 120/80. Then it was 130/90. Then it was 130/80. Then it became 140/90. Then it became, if you're over 70, 150/90 was okay. And I was like, oh my gosh, this is frustrating for me to learn because I have to take tests. Frustrating, imagine being a patient and you going to the doctor one day and them saying, you're at goal, let's have a party. You go back again, they're like, oh, you're not there anymore. We changed the guidelines. So it's more, as we learn more information, it might change. So for you as an individual, I always say yours is going to be different than his goal, which is going to be different than his goal, because it depends on what other conditions you have. So if you've got no other risks going on, and it's just high blood pressure, you might get a more generous goal than someone who we need to keep a little tighter. Yeah. Yes.
My experience is when I donate blood or go to the doctor, they have the machine. It's always sky high. So my doctor, he takes it with a cup 3 times after the machine, and he gets a better reading.
Are you nervous when you're giving blood or anything like that? I know I usually get nervous.
The machine is always high.
Yeah. Interesting. Yeah. Well, then keep having your doctor take it with his cup or her cup.
I take my own at home with a cup.
Oh, okay. You actually inflate it. Oh, wow.
It's all together.
That's very impressive.
And the other 2 hoses,
Yeah.
cup, and then you put the little thing
I'm actually very impressed. I don't know. I've actually never taken my own blood pressure or thought, well, aside from using like an automatic cuff, I've never thought to manually do it myself on myself.
But I get good readings, and I keep logs, and I take
I love
it
that.
like sometimes, it's a little high. In the evening, I'll take it, 4:35 o'clock.
I love that. Good job taking your blood pressure and nice job documenting it as well. Yes.
I had the wrist, one that you took on your wrist, and my doctor told me to bring it with him. I did. I used it while I was there, and then he took it. They were not, matter of fact, the wrist one was way off. And then I got myself the Omron one for the arm, and I took that in. And that one was a lot closer to what the doctor and the nurse was doing.
Yeah. I like wrist cuffs if someone is in, like, has controlled blood pressure and they're just using it as like just a spot check. So taking it on your wrist, what ends up happening is it ends up underestimating your blood pressure, actually. And you have to hold it at heart level. So you actually have to hold it like this, close to your heart when you're taking it. Again, following the other 90-degree angles that are beautiful, but they're not as accurate as a arm cuff here. So that is correct. I don't usually use it if someone were trying to get control of their blood pressure. I would use it for someone who has controlled blood pressure that maybe they want to do some spot checks on their blood pressure to see how it's doing, because that way you know what it is at baseline with the wrist cuff, and even though it's inaccurate, you can see if there is a change, you know what your baseline is. Good point, though, and thank you for sharing that. Yes.
What's your opinion about the numbers? Like mine, the high number is always higher, but the lower number. And he always kept concentrating on the higher number. And then I talked to a pharmacist and I said, what if 2 out of 3 is good, like your beats per minute and the lower number? And he says, he has high blood pressure, the pharmacist said. And he said, as long as that higher number isn't out of control, and then your other 2 numbers are good, 2 out of 3, and those are the important ones. He said, I would worry about that higher number. That's why I like your grandma, because
Are you friends with her?
100 plus her age.
No.
Like, remember the eggs were no good, cholesterol did? We were taught it's our most perfect food. Well, guess what? The egg is back.
The egg is actually, that is also gone, because it's hard to extrapolate if that's the one reason. So that study we'll talk about that one another day. But okay, so if your top number is high, but everything else is good, there's medications that can just target that top number. So instead of hitting all of them, you can try and get a medication that's going to do more with that top number than the rest of them. And so I would encourage you to have a conversation with your provider. Take a look at which medications you are on, because that top number does matter. Hannah, I think, went over a hose analogy with you. That's going to be so like what's happened with my poor grandma, and I don't feel bad saying this because she's not here, is when she gets like you're Doreen, don't tell her. I know you know who she is.
We'll be on 199. I think she'll figure it out.
That's funny. So she had a bloody nose once, but her blood pressure was 100 plus her age, and it wouldn't stop. So it's really hard, and that's what we're really nervous about, is those like bleeding, so those nosebleeds. There's a higher risk of stroke just because that pressure constantly going through, like with that hose, it's just not good for your arteries and veins. So depending on how high your top number is, I would say it is important to make sure you get that to a reasonable number. And it's probably not very, I wouldn't even say 100 plus my age, put it that way. Like a goal would not be 100 plus my age. It's like, Grandma, did you learn that when you were in your 20s? It's no longer true. Actually, when you see her, you should ask her about that story. She'll be like, yes, it's true. Nicole always tells me I shouldn't do that. Any other questions? Yes.
I was just wondering, I'm up in age, and I never had to take blood pressure medicine until I was way up there. I was on good health all the
That's a great question. So, with going on medicine, so oftentimes I'll see people start medicine, and I'm not saying this is you, they'll hit their goal and be like, yes, I can stop it. And I'm like, well, you're at the goal because you're on the medicine. So that's one piece of it. But maybe you continue to go down because now you've lost weight, you're watching your food intake. Is it possible? Yes, it could be. But I will say as we get older, our bodies get more and more tricky, especially being female. We've just got so many more fun, we'll call them, things going on being female. So don't be surprised if you didn't, but it's not unrealistic to never come off of it. So if you're able to make those lifestyle changes, do those things, yeah. So we've had people that have had that happen to them, which is fantastic. But to keep it realistic, it doesn't always happen. It could, but if it, yes, and work towards it. So making those beautiful changes that work in your lifestyle to be able to get in line with potentially coming off. But again, someone could take something that lowers their heart rate and then their kidneys are like, haha, I'm coming at you now. And then your kidneys start being funny and you have to take a medicine to help it with your kidneys. But then there's so many other organs in your body, and your body is so smart to our demise that it compensates in other ways. So usually what I see is we need 2 medicines at least to control blood pressure. Same with diabetes, just because you've got multiple organs. Yeah, good question. Yes.
My wife used to, she got diabetes,
Uh-huh.
took multivitamin and cinnamon and stuff, and she'd take that whole file.
Oh.
And I said, how does your stomach know what to do with this stuff? It's a whole mixture.
Yeah, that's a great question. So when it actually gets into your stomach, the pills are made to dissolve a certain way, and then some of them start to get absorbed in your stomach, and then it goes into, so anytime you eat food or anything in your stomach and then into your small intestines is the next stop, it starts to pull things out slowly and put it into your blood. And then your blood has things that catch it. So when you take something like Tylenol, it doesn't know, it's not like Tylenol is like, oh, I see you have something in your foot, I'm going to go to your foot. It goes to where your pain stuff is and blocks pretty much all of them. So it's not necessarily, your bodies are smart, and the pills they make them dissolve a certain way, but they do get into your blood, and then they work from there. But yeah. Do you have a question? Stress. So interesting question. So she asked about stress. I work at a grocery store pharmacy, and I will take the store manager's blood pressure. And he's like, Nicole, it's only high when I'm here because I'm stressed. And I'm like, okay, well, how long are you here? And he's like, usually 60 hours a week. And I'm like, okay, well, we need to manage that. Stress releases cortisol. Cortisol is a part of your body, and it wreaks havoc, basically. And one of the things it will do is raise blood pressure, because if you think back into the cavemen days, right? Fight or flight. So you were either going to fight something or you were going to run away from it when something happened. So if I had a bear walk up to me, I'm not going to sit there and try and be empathetic with it and be like, oh, he's hungry. I'm running, right? So what's released in that situation is cortisol. It's a stress hormone. It's going to cause my body to react. My heart's going to race. My body's going to get ready to do something. So whenever there's stress, it's going to just have you in that constant state of having that being released, which does cause higher blood pressure. So if someone had high stress, first thing I would encourage is potentially going to talk to somebody, whether it be a therapist, going to CBT, doing some mindfulness activities, working on managing that stress. Maybe it's a medication for stress in itself. Or if you go on a medication for blood pressure, but then you start managing that stress a little bit more. Because honestly, stress is, someone once said to me, I want my stress to be 0. And I'm like, no, stress, there is some good with stress. Like having a grandbaby, that's stressful, but so exciting. I like to think it's exciting. It's exciting, right? Going to a wedding, stressful, but good. Having family over for an event, it's probably very stressful, but there's also some really niceness in that connectedness. So there is good stress, and then there's negative stress. But yes, stress can affect blood pressure, and it is important to manage that as well. It's a good question. Yes. Oh, supplements. Oh, I know. I have had people on like 20. Yep. Supplements. And what's my theory on that? So as a pharmacist, you'd probably expect me to like them. I don't. I only recommend people take supplements in the areas that they're deficient in. So I never want someone to overtake medications. I just don't think that that's necessary. It's expensive. They interact with other things. So a lot of supplements interact with your medications. So knowing the timing of it. So the best example would be something like levothyroxine is something people will use for thyroid. That interacts with calcium and multivitamins, and it makes both of them get into your stomach. We'll say they fall in love because it's Valentine's Day, and then neither of them work as well because they're too busy snuggling in your stomach. So we want to make sure that the timing of them works appropriately. So supplements, my recommendation around them would be, A, what do you actually need? Let's get some blood work. And it could be basic blood work. It can be like maybe your vitamin D is low. Maybe you're on alendronate, in which case you would take a calcium product. Maybe it's you're low energy and you're on metformin, then okay, maybe a vitamin B12 would be necessary. But I wouldn't ever put a blanket statement for everyone to take it because you just might not need it and it's expensive. Yeah, and it can be hard on the stomach. So if you ever notice you take like a multivitamin or a supplement and your pee is yellow, people will say it's because you can't absorb that much of that ingredient. Yes. Zinc and vitamin D. Great question. Vitamin D is a very good option. Most of us are deficient in it just because we live in Pennsylvania. There's no sun. But I would encourage you, because there's a certain dose you would need depending on how low you are. So finding out where your levels are can help me to pick the right dose of vitamin D. And in terms of zinc, zinc does interact with a lot of things, but there is some evidence that it can reduce cold symptoms by 1 day if you take it at the onset of you feeling sick. So if your throat starts to feel scratchy and you start taking it right then and there, it could reduce your symptom severity by like 1 day. So it's a toss-up. I would have to look at someone's full list of medicines, but that one there is some evidence to say it can reduce how long you're sick for. But don't start taking it until I know if it interacts with any of your other medicines you're taking prescription-wise. Yes.
You mentioned calcium.
Yes.
I don't have a problem taking pills normally, they go down.
Yes.
For some reason, I cannot take calcium, they just stick. So I cut them in half, they still stick.
Oh, geez.
They still stick.
Yeah. How about, so with calcium, there's a couple of different kinds out there. There's calcium carbonate and calcium citrate. Depending on what other meds you are, one of them is probably better than the other for you. I would encourage, there's gummies and chocolate, actually calcium. So like Vivactive is like a chocolate calcium. Depending on how much you need, maybe just go ahead and make that your treat for the day and have the chocolate one. Because those pills can be a little bit larger. There's also Citracal Petites. Those ones are the smallest ones that I've seen, and if those still aren't working, I would go ahead and do like the gummies or the chocolate version of it and just get one of those and enjoy it. Yeah. All right. Thank you, everyone. Oh, I have one more question. Yes.
Can you take different type of prescriptions at the same time?
Can you take different prescriptions at the same time? Most of the time, yes. But there are some that you would want to separate. So if you're on a bunch of them, what I would say is talk with your pharmacist. If you don't have one that comes here, ask Doreen and we can maybe schedule a time to chat, or I can come up with my students and we can look at medications for you individually and we can tell you like best timing to take them. But I have people that take 10 medications and they'll just put them all in their hand and take them at once, and that's fine. Things like I said, like the best example that I can share that many of you might know would be like levothyroxine. And even like having your multivitamin with breakfast 30 minutes later, you wouldn't want to do that. You would want to separate that by 2 hours. So there's just some caveats like that. Most of the time, it's okay to take your vitamins and prescriptions together, especially if it's like blood pressure, cholesterol, and things like that. There's just those couple of nuances. And if you have a specific question, again, I'm happy to meet with anyone individually as well. And as long as you're okay with me having students, we actually don't charge for medication look-ats, as long as the student can be there to learn too. Yes?
I know, it's one of the things I do. It's not a question, but I take Levo. I generally have to get up in the night to go to the bathroom. That's when I take my Levo. Then I don't have to worry about food or anything else.
I love that. All right, so midnight snack is your levothyroxine. As long as you're not, like, the one thing I say with, like, bathroom breaks, like, if you need to talk, like, if it's because you're drinking a lot at night, fine. But if it's uncomfortable for you, you could talk to your provider, too. There might be some options that you don't have to wake up in the middle of the night, because that would, that's, midnight snack is, okay, well, are they allowed to take blood pressures then? Okay. My students are going to stay back and they can take blood pressures. If you have specific questions on medications, though, I do have to head out, so they can't personally answer them. But you can talk to them, and they can maybe if you wanted to call me and ask a quick question, you could. But no, we won't. They won't be giving any personalized medication recommendations today. But they can take your blood pressure, and you can tell them that you're really excited to talk about your meds, and maybe they can schedule you a time. We could probably do it over the phone next week if you wanted to, or I can schedule a time with Doreen if a lot of you are interested. Thank you so much.
Nicole, thank you very much. Hannah, Steve, thank you. So this concludes the Eventful Living and my wellness series for today. Don't forget, walk 30 minutes a day. She said it. I know I have the challenge going on. Make sure you get that 5 miles in. They're going to be here to take your blood pressure if you'd like. Just let them know and they'll come over to you and take your blood pressure. Thank you very much.